I want to now bring in Wendell Porter, former vice president of corporate communications for Cigna. He is now an advocate for health insurance reform. He's also written a book, Deadly Spin, An Insurance Company Insider Speaks Out on How Corporate PR is Killing Healthcare and Deceiving Americans. So, Wendell, thank you so much for being here. This is, of course, a horrific crime with no suspect in custody and no known motive. It's also driven some intense, critical comments online about America's health insurance industry. I wonder, for you, who's someone who's been inside this industry, were you surprised by the level of anger that you saw after this shooting in terms of it being directed at healthcare companies? And I wonder, when we talk about the lack of healthcare coverage for Americans, there's also this focus on even the people who do have health insurance. They often are regularly denied claims. So I wonder what you make of all of this conversation.
You know, I've been surprised a bit by the volume and the vitriol, but I'm not shocked because Americans have been angry at health insurance companies for a long, long time. I knew that when I was in the industry. We used to do surveys to find out what people thought about us and what we might be able to do to improve our relationship with our customers. And we always were told what you need to do is pay our bills and get out of our lives. But instead of that, these companies have gotten increasingly involved in our lives, our healthcare. They have become enormous corporations. And you may recall, I became a whistleblower. I testified before Congress almost 15 years ago when Congress was debating what became the Affordable Care Act. And I warned policymakers about the role that Wall Street plays in our healthcare system. And that's significant because Brian Thompson, the executive at United Healthcare, was there for the company's annual investor day. And that's indicative of just the importance that these companies place on Wall Street. They control our healthcare system in ways that most people don't understand. And that is why people are upset.
Yeah. And as you think about the anger toward United Health in particular, that company is facing multiple lawsuits over denial of coverage. They have argued that those lawsuits should be dropped because of appeals were not completed. But I wonder, just last month, a Senate subcommittee published a report that found the company was using algorithms to consider claims, and it knew it caused the number of its denials to rise. So United said the report misrepresents their practices. But I wonder, as someone who, again, is in this industry, what danger do you think AI poses in how insurance companies operate?
AI poses a huge threat to our ability to get the care that we need. These companies, without AI, have been able to deny care for a long time. They do it through something called prior authorization, and that has been increasing every single year, not just at United, but in the other companies. Where I used to work at Cigna, there were reports earlier this year about how that company is using algorithms, how it's using AI to deny claims by the thousands in one fell swoop. So that's what's going on, and that is why people are becoming increasingly upset and are taking to social media to express that. Now, the industry for years has been doing, again, surveys trying to make people believe that we are satisfied with our health insurance company. That is just simply not true. And I think this may, as sad and awful as it is, there is no role for violence in our society, and certainly for someone seeking vengeance, who knows what the motive was here. But maybe this will be a catalyst for some real thinking and some real reforms that need to take place.
Yeah. And as you think about sort of the consequences of what is, of course, as you said, a horrific shooting, there is this also conversation that happened this week about Anthem Blue Cross Blue Shield. This week, it reversed a plan that would deny anesthesia coverage if it went over a certain time limit. The initial announcement of the change prompted outrage from leaders in New York and in Connecticut, where it would have been tested first. The company claimed it was simply misunderstood. I'm not asking you, of course, to speculate about who's right in this situation, but I wonder what role you think public attention to how the industry is operating, how it could protect people and impact the way that these companies are operating.
Now, one thing I am seeing now for the first time in several years is heightened awareness and attention paid by the media and by regular people on social media. This happened very quickly at Anthem. I wrote about it this week before the company made that reversal. And it just gives you an indication of how these companies operate with impunity. They think they can get away with things like this, but increasingly the media is paying attention to these arbitrary decisions that they're making, and so are people on social media. That was a very, very quick reversal that company made. So I think it's these companies, I think, are realizing the world has changed for them, and we'll see. But I think policymakers in Washington are paying attention. I think they are around the states, and employers are as well too. Employers are beginning to realize that they too have been taken to the cleaners by these companies for years. They have not brought down the cost of care, but their profits go up every single year as these companies have been raising premiums, costing our employers more money, costing us more money, also making us pay a lot of money out of our own pockets in deductibles before our coverage kicks in. That's just not something that's sustainable, and people are rebelling about it.